people think that hearing aid can damage hearing, but it is not true. I am Dr. Sanjeev Gupta, practicing ENT surgeon at Apollo Hospitals, Bhubaneswar. I would like to explain about the hearing aids to you. Hearing aids are of two types, analog type and a digital type. Analog type is something which is a simple hearing aid which can be worn by anyone who has a hearing loss, and the only setting in that hearing aid is basically for volume. Digital hearing aids are a more complex hearing aid which can be programmed according to the type of hearing loss. It has to be programmed with the software connected to the hearing aid, and when the hearing aid is fixed inside the ear of the affected individual, and the programming is done to reach a most suitable and comfortable hearing experience for the patient. Hearing aids are classified according to the shape in which they come, in which they are given to the patient. The largest hearing aid, which used to be a traditional hearing aid, was called a body-worn hearing aid, where people would put a small pocket-like device inside the shirt pocket, and the wire will go up to the ear to help the patient to listen. The traditional body-worn hearing aid was analog hearing aid, and it used to amplify the sounds and could hear from most directions to sounds coming to the device. Now, with the miniaturization, the hearing aids are now very small, and the most common hearing aid available is behind the ear pinna, and it rests comfortably over there. The sound is delivered inside the ear using a ear mold. The ear mold makes the fitting snugly, and the sound travels comfortably inside the ear canal. The smaller hearing aids are miniature BT or miniature behind the ear hearing aid, and also the smaller than that is in the ear hearing aid. Also, some people like invisible hearing aids, so we are now having even inside the ear the hearing aid, which is called IIC and CIC, completely in the canal and inside the canal. These hearing aids, miniature hearing aids, are digital hearing aids, but as the size decreases, their capacity is also less. So smaller hearing aids can help you if you have only mild or moderate hearing loss. Mild hearing loss or moderate hearing loss is basically defined by the audiogram, which you do when you visit an audiologist at the doctor's clinic. Mild hearing loss is when you have a hearing level between 25 decibels to 40 decibels, and moderate hearing loss is when you have a hearing level of 41 decibel to 55 decibel. So if you are having a hearing loss of mild or moderate nature, you can opt for a very small hearing aid which is hardly visible or invisible. If you have moderately severe loss or severe hearing loss, then you can go for a larger hearing aid which is in the ear or behind the ear hearing aids. If you have profound hearing loss, then there is no hearing aid which will help you. Profound hearing loss is basically when your hearing level is more than 90 decibels, and in such case hearing aids, if you use, will help you in only getting to know the direction of sound coming to you. It will not give you any clarity of sound. Hearing aids are given mostly to the elderly people when the hearing has reduced due to presbyacusis, or it's a natural aging process of the individual where the nerve has become weak. As the hearing nerve, which is also called the auditory nerve, becomes weak, we have no other way to treat this other than give hearing aid to amplify the sound in a correct fashion so that the patient is able to hear properly. Also, sometimes a conductive hearing loss due to bone fixation, ossicular disruption, otosclerosis, are fitted with hearing aid. When there is a perforation in the eardrum, that is also a conductive hearing loss, is fitted with the hearing aid. When the patient does not desire to have surgery and therefore he opts for a hearing aid. In children with congenital deafness, we also give hearing aid with limited benefits. Hearing aid users should know that using a hearing aid will not damage their ear. In fact, it will help them lead a normal life. Hearing aid users should also know that the wax can block the hearing aid, so therefore the ear has to be kept clean and wax should be removed periodically. Hearing aid users also have to understand that these are battery powered hearing aids, and the battery has to be changed about one battery in every 5 to 7 days. We also get rechargeable hearing aids where you don't have to change the battery, but you'll have to charge the battery regularly. Also, these hearing aids can be connected via Bluetooth to your Bluetooth devices. Also, it can be paired to a telephone, so the receiving telephone call becomes much simple, and the hearing aid may need a periodic servicing by the company personnel. So therefore, always buy a hearing aid close to your house so that you can get help whenever you desire, whenever you need. And the hearing aid has to be maintained. It's an electronic device and it needs some intervention and help at periodic intervals. When any individual faces hearing loss to the extent that it causes difficulty for him to carry out routine activities, he should go and visit a doctor. Also, if he finds imbalance in hearing, that one ear is hearing more than the other, again he should visit the doctor and find out the reason for the hearing loss. Hearing aids can be used comfortably with especially the digital ones, because of the comfort it provides to the users, and it does not cause any hearing damage, and one can use it comfortably so that the quality of life improves and one is able to lead a normal life. Thank you.